Eddie Turner, the Leadership Accelerator. I work with leaders to accelerate performance and drive impact through the power of executive coaching, masterful facilitation, and professional speaking. Today, we are streaming live on LinkedIn, Facebook, and YouTube. Feel free to hit that share button so that your friends can join our conversation or have access to the recording later on when the session concludes. And if they should miss it here on social media, this session will be available wherever you download podcasts. If you have questions, feel free to ask your questions live during our session, or certainly I encourage you to follow my guest on social media on LinkedIn. You will want to stay connected to this expert. You will also want to visit his website, which I'm going to mention several times because it's very important that you go to houstonsleepspa.com. What if I told you that there is a silent epidemic that is affecting as many people as diabetes and asthma? But 90% of the sufferers don't even know they have it. Well, because of that prevalence and its impact on people and their ability to show up as the leader that they like to show up as, I have brought in an expert who I highly respect, and I respect so much he helps me. I've brought in Dr. Michael Landry. Dr. Michael Landry is a board certified diplomat in aesthetics and sleep dentistry and the founder of Consultants in Dental Aesthetics right here in Houston, Texas. And he's going to talk to us today about dentistry and sleep apnea. He has been
Yeah.
a pioneer in groundbreaking alternatives to CPAP therapy, and he speaks and lectures across the country. He's got about 50 letters after his name and several fellowships and diplomats. And so I can't wait to share his expertise. And I will tell you, as an aside, I affectionately refer to him as the man that either saved my marriage or saved my life. Because of I didn't know I had sleep apnea. Because of that and my snoring, my wife was either going to end up divorcing me or smothering me to death with a pillow. But I'm happy to say that I'm still alive. We're happily still married and still madly in love, and both getting a good night's sleep as a result.
That's
So,
great.
Dr. Landry, thank you and welcome to the Keep Leading podcast.
Absolutely. It is my pleasure to be here. You're absolutely right. Sleep apnea is the most underdiagnosed epidemic that we have in our country. And as you alluded to, 90% of the people that have sleep apnea have not been diagnosed.
Mhm.
There's many people that have sleep apnea as there are that have diabetes and asthma, a huge number of people. And most of those been diagnosed, they know something's going on. So many people like yourself, I just snore. I get tired in the afternoon. I wake up with a headache in the morning. My wife and I sleep in separate bedrooms. We haven't slept in the same bedroom in years. And many people aren't willing to want to try CPAP. CPAP works and it works great, but many people are unable to wear it. So many people say, hey, I can't wear it. I'm not going to wear CPAP. I'm not going to do that. Well, there's many other alternatives. We have oral appliances, mandibular advancement devices is a fancy name for those.
Mhm.
There's also Inspire, which is a surgically implanted implant that goes into your chest and helps to keep your airway open at night. So there's many ways to treat sleep apnea that people just aren't aware of.
Now, you mentioned something there that I want to underline. What is the indicator that a person has sleep apnea?
Well, there's several comorbidities that go along with it. We have a particular acronym. It's called STOP BANG. S for snore, T for tired, O for obstruct, that someone has told you that you stop breathing at night, P for pressure, high blood pressure, B for BMI, A for age, N for neck size, and G for gender. And if you're a male with a 16 and a half inch neck, over the age of 50, with a BMI of 2, your snore, then those 5 put you at high risk. If you answer 3 of those questions, it puts you at high risk for sleep apnea.
Okay, good to know. And even some technology has been introduced with people where, for example, an Apple Watch, you have the ability to set your
Yeah,
Apple Watch to help you detect that. So if
right.
somebody isn't telling you that you're snoring too much,
Yeah,
as you said, don't, as I did, dismiss it and just think, oh, I'm just tired. I work a lot of hours. I stay up late.
yeah.
It actually could be the first indicator that you are suffering from sleep apnea. But I actually learned it not from someone I would have thought I would have learned it from, but from you, my dentist. So,
Yeah.
as a dentist, what was the indicator that I was suffering from sleep apnea?
Well, you're a male, you're over the age of 50, your neck is bigger than 16, and you have high blood pressure, right?
Hmm.
So there you go. There's four of them right there. And I get that in your medical history. Your dentist gets that in your medical history. Maybe not neck size, but you can look at someone, you can tell is their neck size big or not. Do they have a B? Most all of us Americans nowadays have an elevated BMI. Notice how I call
Hmm.
that elevated BMI. It doesn't say that we're fat, but we
Hmm.
have an elevated BMI. If you have a BMI that's over 30, then you hit that group.
And you noticed something in my bite.
That's right. Part of it is that people that have sleep apnea also grind their teeth because when they
Yes.
go apneic at night and they stop exchanging air, they don't stop breathing, they still expand your chest, contract your diaphragm, do all the things that you would normally do, but no air goes through. You're just like snoring and it just stops, dead
Yes.
quiet. And that's when you're obstructed. And during that time, then your oxygen level starts to go down, your CO2 level starts to go up, and your brain says, "Excuse me, Eddie, we're dying." So what does your body do when you think it's dying? It squirts out some epinephrine, the adrenaline, the fight or flight hormone, and that epinephrine causes you to clench your teeth together, grind your teeth around,
Hmm.
because that brings your bottom jaw up and forward and opens up your airway. So for someone who grinds their teeth, that's another indicator that your dentist is going to talk to you about. Hey, you grind your teeth. They say, no, I don't grind my teeth. Well, yeah, the flat spots on your teeth indicate you grind your teeth. And there's another thing that we also notice. It's called a scalloped tongue. The edges of the tongue, they kind of go round and round because they're close to the teeth because the tongue is squishing out against the teeth all the time.
Yes. So you pointed out my grinding that you noticed, and you combined obviously with I was overweight, still am overweight, but a little bit more
We
so at the
all are.
time, and that was and you started to ask me about that. Then I said, yeah, I do grind my teeth at night, and yeah, I do kind of find myself waking up grasping for air, and so that was the indicator, and you set me
Mhm.
on my way, and getting on the sleep apnea path has been a tremendous help for me. So I just want to highlight that for leaders that obviously that if we're not able to get a good night's rest, that clearly has an ability on how we show up as a leader. And so
Yes.
getting the assistance from an expert like Dr. Landry can go a long way to helping us be the leaders that we want to be.
Yeah, sleep is so critical in our lives. In fact, if someone has been sleep deprived for 24 hours, they are inebriated or they are disabled enough to be equal to someone who has a 0.8% alcohol blood level, 0.08% alcohol blood level.
How
So
about that?
next time you go to the ER, ask your doctor, hey, how long has it been since you slept? He says, oh, it's been about 36 hours. Say, give me somebody else. I don't want the drunk guy. And when you talk about leaders, if you're chairing a meeting and you haven't slept the night before, then you're one of the drunk guys up there. You're not going to think it's good. You're not going to act as good.
That's a staggering statistic, Dr. Landry. So you're saying even if I'm a person who is sober, I don't drink at all. If I am showing up to work and haven't slept well in 24 hours, 36 hours, I'm
Mhm.
as I am as inebriated or as ineffective as a person who's so inebriated that their blood alcohol level is at point 0.8.
That's right, 0.08. And
Point oh
that's
0.08.
this
Sorry.
that's
Yes.
the same thing that makes you legally drunk.
Yes, sir.
And it's not like you're staggering, slurring your speech, but it's your mind processes. The things that's
Mhm.
so important for leaders to have that mind going all the time, to be creative, to have that futuristic, visionary type thinking.
Thank you for sharing that. That certainly underscores the need to not only get the adequate number of hours of sleep per night, but the quality. And that is certainly something we
Right.
can do if we have the right sleeping aids,
Exactly.
like getting the sleep apnea treatment. Now, if I am not, because you're a dentist, but
Right.
you got into this area of of sleep.
Uh-huh.
How did that take place?
Well, that's another thing that we haven't discussed, talked about, that is things that happen from having sleep apnea, comorbidities, as we call them.
Hmm.
In that I have a history of Alzheimer's in my family. My grandmother died of Alzheimer's. My father died of Alzheimer's. I've been tested. I have the APO4 gene for Alzheimer's. I have a 75% chance of getting Alzheimer's. That's why at 70 years of age, I'm still working and I plan on working the rest of my life because I want to keep thinking all the time. Because as soon as I stop thinking, I will stop thinking. During sleep, our conversation right now is going to a place in your brain called the hippocampus. Hippocampus, that's a short-term memory. At night, during NREM 2 stages of sleep, that information is uploaded from the hippocampus to the cortex. It goes from short-term to long-term. If you don't get that quality sleep, then you don't get that memory consolidation occurring. And so it leads to short-term memory loss. So that's what got me first involved in it, and that I thought I started looking at how can I keep from getting Alzheimer's like my father, like my grandmother. And that was one thing that popped up on my list when it was talking about sleep. And further investigation just led me into this pathway. And it's been very rewarding for me because I have people tell me, you gave me back my life. I didn't realize what it was like to sleep. In
Yes.
fact, I heard someone from that just this past week tell me that.
Beautiful. And I can relate. I mean,
Yeah.
until you've gone through it, you don't understand how much you may have undervalued quality sleep.
Oh,
And
yeah.
then when that's returned to you, it is a true gift, and it is if
Mhm.
new life has been breathed into you.
Absolutely.
Fantastic. Now, if I'm not interested in being a Hollywood celebrity, is there a reason I should still be concerned about the quality of my smile?
Oh, absolutely, Eddie. You know, the first thing anybody sees when they look at you is their smile. I mean, you've got a great smile. You really do. Come on, show me those teeth again. There you go.
Thank you.
And it's that's the first, the key contact points we have with another human being are going to be the eyes and the smile. That's going to be the first thing you see. And if you don't have a smile that you're proud of, then you're not going to smile. You're going to give it the lip
Mhm.
thing like that.
Yes.
I had tetracycline saying as a child up until adulthood. And as a result, my smile and my pictures growing up was always just like that. No teeth. After I got veneers placed on my teeth and I got my real teeth in my head, I was on a trip with my brothers. We were riding motorcycles up to Four Corners to stand on the spot. And we had these little bitty cameras. It was before the days of cell phones. Well, we had cell phones, they didn't take pictures. And we're looking at these little cameras, and you blow up the picture on the back, and you can see what the picture that you took, these little digital cameras. And I started noticing this thing on my face I had never seen before. It was this horizontal white line. I'd never seen that before. It was my smile. It
I
was my
love that.
teeth. I was showing teeth when I smiled. And to me, that was a big moment in my life.
And it
And
makes a difference in how you come across.
oh, absolutely. It gives you that confidence level because when someone's always, talking to you like this or, like that, you just don't have as the connection with them. You don't have as much confidence in them. I mean, if you're in sales, gosh, in sales, it's smile. If
Yes.
you're in leadership, what's it about? It's your smile because you're going to communicate more with the people that work for you through your smile than you are with your frown.
Excellent. And you highlight this a lot in your book. So the idea that hey, you don't need to worry about your smile if you're trying to be the next great actor in Hollywood is not true. It matters
No,
at everyday level in whatever
no,
profession we're in. How we are perceived as a leader is directly connected with the quality of our smile and our teeth.
absolutely.
So if someone's listening to us and they've had challenges that perhaps no other dentist could resolve.
Mhm.
And they're listening, thinking, boy, I'd like to have a better smile, but I'm told there's no help for me. What do you say to that?
Come see me and we'll talk. I've had lots of people that have come to me and they said that, yeah, the dentist said I couldn't have implants. The dentist said I couldn't have veneers. Yeah, the dentist said I couldn't have crowns. The dentist that said that just didn't have the confidence level in themselves, didn't have the expertise. They weren't able to perform the procedures that were required to give that patient the result that they wanted. That's why I've studied so much in my life. I've learned so many things that if you don't, I'll back up a little bit. In dentistry, you have to be a continual student of dentistry. There is nothing, not one single thing that I still do the same now that I did when I was in dental school. It's all changed. I've been doing this for 44 years, so you can imagine there's been a lot of things that have changed. And when something comes out, you have to have that ability to discern which is good and which is bad, which is going to be affected. And sometimes it's should we? Can we? Is that the right thing to do? Just because we can doesn't mean we should. And there's a lot of things that come through dentistry are in that category. So you have to evaluate, and is it going to give us longevity? Is it going to give us beauty? Is it going to give us function? Is it going to give us all the things that we need? Or is it just new technology?
Yes, indeed. And you are a continuous learner and you continue to enhance the quality of offerings you provide for patients because of that. And when I was in your office, you shared with me some sophisticated technology that you're using in terms of 3D and and how you something that normally would have had to be sent off someplace. You do it right there on the spot. Tell us about that.
That's right. I've been using CAD CAM 3D technology since 2004, actually, to make crowns in a single visit. When you come in, we can prepare the tooth. We can scan it with an intraoral scanner. We don't put that yucky stuff in your mouth that makes you throw up and gag. And then we can put that on the computer, and then the computer and I can design a crown together. We send that to a mill, kind of like a CNC machine in the office, and it takes a block of porcelain and it mills out everything except what that tooth looks like. And then that tooth can then be cemented on the crown that day, which it helps in many ways, and that it reduces postoperative sensitivity, because when we put a temporary on and you go out and spend 3 weeks waiting for that permanent crown to come back in, and well, that temporary is kind of leaking and you're getting some of that oral bacteria up underneath the crown, which can lead to sensitivity, as well as when the crown falls off because you ate something chewy and sticky, you forgot, then you got to go back and get it glued in again. We get past all those. Now, is that indicated for each and every restoration that I do in the mouth? Absolutely not. There's certain times when I need to use a different material, one that I can't use on a CAD CAM basis. Sometimes we actually use gold. We still use gold sometimes on people's back
Okay.
teeth because they have such powerful bites that they can destroy anything else that we put in there. So we have to go with
How
that.
about that?
And milling a block of gold to get a gold crown wouldn't really be cost effective. And someone that I'm taking and I'm doing 10 crowns on all their teeth. I'm covering all the teeth. That's something I'm usually going to send to a lab. I'm not going to do that in the office. Could I? Yes, I could. Should I? No, maybe I shouldn't. Because just because you can doesn't mean that you should. And if it, I could sit there with the patient in the chair for 10 hours to get that accomplished, but would I really be serving the patient well? Or if I can accomplish all that work in maybe 4 hours, wouldn't that be better for them? So it's not just
Indeed.
about me, it's about the patient. And that's what we make is we have a patient-centric office. It's all about the patients. It's not about me. It's not about what hours I want to work. We're open Monday through Friday. We're here to serve you. And it's about what your needs are, what your wants, what your desires are. And that's why I'm going to tell you what all the possibilities are. And you may say that, I'm not interested in making a smile over. And I'll say, well, let's look at your smile. Let's talk about it. Is there something that you ever stopped doing because you're afraid to smile with your teeth? And it's opening up those questions, finding out what those, you could call them emotional disabilities, reasons that a patient changes their actions because of their smile. And they many times don't think about that.
Indeed. It's like a beautiful woman who's just gotten that new and shiny engagement ring. She all of a sudden starts to use that left hand a little bit more,
Oh,
right?
yeah, yeah, yeah. Right-handed people become left-handed after a wedding ring.
Absolutely. So the same is true. When you have a nice smile because of having seen a great dentist like yourself, you want to show it off. And it's not even that you're forcing yourself to. You just love how you look and feel so
Right.
much you can't
Yeah.
help but smile.
And
Well,
it's sometimes a functional thing too. Uh, I had a patient once that quit going to her friend's house to have dinner because she couldn't chew.
oh,
She couldn't chew when she went to her
how
friend's
about
house.
that? Okay.
And it wasn't until I asked her these questions, these leading type questions of, what do you think about this? What do you think about that? Did that really come out? And so for those patients, we can put implants in their mouth. We can put implants to restore teeth again. We can give you something to chew with so you can go to your friend's house and have dinner without being embarrassed.
Again, another gift that you are able to return to someone through the quality work that you do. Truly
Thank you.
life enhancing and life changing. Well,
That's
I
what's
want to
really
highlight.
cool. That's cool about dentistry, really is I get to do things like that for people. People always think of the dentist, you're the pain giver, the mean person. No, it's I can give you back your life.
Yeah, you do give a little bit of pain,
Well,
but you do it with a smile, and you do
yeah.
it in an environment that is second to none. So I want to
Thank you.
highlight that right now. What I've put on the screen, those who are going to hear the audio podcast can't see this, but I've got HoustonSmileSpa.com on the screen. Those who'll see the video and who are with us live, we've got a few people who've joined us from YouTube that I see. They're able to see this. This is what your office looks like. Now, sometimes you see a website and then you show up to the actual facility and it looks nothing like what you saw online. Let me tell you, folks, that is not the case. This does not look like a dentist office. This looks like just a stellar, looks like the cover of Architectural Digest, quite frankly.
Thank you. Thank you.
And that's what it looks like when you go there. And I can't show you the pictures that I've taken of during my visits, but when you step in here, it is truly a breath of fresh air, and you will see that it truly looks and functions like a spa. You owe it to yourself to go visit Dr. Landry and his team at Consultants in Dental Aesthetics. Now, I'm very loyal to people who do services for me. And when my wife found Dr. Landry's office, she kept telling me, "You need to go. You need to go." I'm like, "No, no, I like my guy." And I did. He's
Yeah.
an amazing dentist. But
Right.
I got too busy and I missed my window for appointments and I couldn't get in with him. And so it was at the end of the year and I wanted to get that last visit in. And so I said, okay, I'm going to give Dr. Landry's office a try. I
Yeah.
went and I missed my good friend, but I'm never going back. I fell in love with Dr. Landry's office from day one, and you'll see why. Now,
Yeah, we call
here's what
that
it
our
looks like.
reception lounge. That's our reception lounge. We don't call it a waiting room because we don't want you to spend time waiting in there. We want to receive you. There's going to be someone who's going to open the front door for you when you arrive, and they're going to open the front door for you when they leave. And they're going to seat you in the reception lounge. They're going to ask you, "Would you like a beverage?" They're going to help you if there's any paperwork that needs to be filled out electronically that hasn't been done yet. And they're going to make you feel comfortable. We're going to welcome you into our home.
Indeed. And people who know me know that I'm maniacal about quality and customer service. And it's intricately tied to leadership. And so when we talk
Yeah.
about
Mhm.
keep leading, what we're doing here on this show, this is a part of it. And you are leading in a way no one else is doing in dentistry. So your book is a category of one, and you
Right.
truly are a category of one. And I just want to highlight something that you say here in the book that I showed that in the pictures. But here's what you say, and I have to read this verbatim. Our practice is highly patient centric. And I just love that phrase.
Mhm.
Every detail of patients' experiences has been designed and refined. The difference in our practice is evident at your first visit. When you walk through our front doors, you don't enter a waiting room, as you just said. It's a comfortable reception lounge. Our front office people are not front desk, quote unquote. They're concierge. We offer silver tray service where you can have champagne or mimosa. You can choose a beer, a glass of red or white wine, or water. We have a full service coffee bar if you'd like a latte. Most importantly, we serve you. And another point that you make here, finally, that I want to highlight is what is a category of one dental practice? It's a dental practice that values the power of distinction versus the cost of blending in. It's
Right.
one that goes above and beyond for its patients, creating an environment that's difficult, if not impossible, for others to duplicate. This distinction doesn't just apply to our physical building, it's also found in how we treat our patients and the services we provide. It doesn't get any better than that. And I'm here to tell
Thank you.
people this isn't just something you wrote. I've experienced it. And through countless visits, it hasn't changed. Sometimes something is great the first time, and you go back and say, oh, that has not been the case. And I
Thank you.
highlight this because, again, this is important to leadership. The experience, how you make people feel when they're in your presence and when they leave, is the hallmark of a great leader. You are leading, Dr. Landry. And I
Yeah,
did
yeah.
some work for years in what's called the experience economy. And this is work
Mhm.
by Joe Pine and Jim Gilmore. And they highlighted the best in class organizations that were separating themselves not on cost. These organizations say, hey, if you want a cheap cup of coffee, there's McDonald's, there's a couple other places.
Mhm.
But if you want a premium cup of coffee, right,
Yeah,
you're going to go
right.
to Starbucks. Well, I'm here to tell you folks, be it that you want a great, comfortable stay at a hotel and you chose, hey, there's some places that if I want to save a couple bucks, I can go to my Holiday Inns or whatever there may be. But if I want a premier experience, I'm going to go to maybe the Ritz Carlton. Dr. Landry and his team have taken the Ritz Carlton experience and placed that in dentistry. Look at where he's sitting right now. Does that look like a dentist's office? So I just wanted to highlight that.
Yeah, that's our greeter station behind us. You're greeted at the front door. There is no one answering the phone. You are the most important person that's in front of that. We have all that stuff in the back. We don't need people answering the phone out in public. It's important that your experience is the most important thing that's going on in our lives at that time. And that's what we
Mm-hmm.
want you to have. It's, like you mentioned, the Ritz Carlton, the Holiday Inn. I use that analogy all the time. Both will give you a bed and a roof over your head, but one will give you an experience and the other one won't give you that same experience. And both are okay. You choose where you want to go to. If you choose to come to Consultants Dental Aesthetics, we're going to treat you as the most valued customer we have each and every time that you're here and the whole time that you're here.
Outstanding. Dr. Landry, we've had a covered a lot of ground during this discussion. There's still a lot of things I
Mhm.
haven't asked you that I want to ask
Right.
you, but there's just one last item I want to get to. You're a man of not just a businessman and a phenomenal businessman. You're also a man who loves his family, and it's evident in what you do. And you're a man of faith, and you believe in
Yes.
giving back to the community. Can you tell us about your free dentistry for a day program and the impact that's had in our Houston community?
Absolutely. It's just for many years we were aligned with a 501c3 that was called Dentistry from the Heart. It
Mm-hmm.
was first developed in Florida, and during the COVID days, that kind of faded out, went away. And we had done, oh gosh, 7 or 8 free days of dentistry. We open up our office. We get, oh gosh, we've had 7 or 8 dentists and 4 or 5 hygienists, and we have seen 197 people in one day. And we have given away $160,000 in dentistry in one day. Well, after the COVID time, we had to resurrect that. So we came up with our own called Gift of Dentistry, the acronym being God. And we have a cornerstone out in front of our building that says, to those that much is given, much is expected. And I want to give back as much as I can. So we have an annual day every year that we've opened up our office. We have 13 treatment rooms and we have all of them full the whole time. And we have oral surgeons, we have uh, hygienists, we have general dentists. We're doing fillings, extractions, and cleanings. All you have to do to qualify is be 18 years old and have some sort of government ID so we can prove who you are. And we're going to take care of you that day. It's, to me, one of the most funnest days that there is, because it's not a me come in and diagnose something and tell you, okay, it's going to be this much. It's just, what do I need to do for you today? Okay, let's do it. Let's just
What
do
a
it.
gift. You truly are a phenomenal man in so many ways. And that's
Thank
why I
you.
wanted to highlight you today, Dr. Landry.
Thank you.
Please tell us the most important concept that we discussed you want people to take away from our conversation today.
Well, before I get to that, I got to give credit to one other person in my world, and that's my wife.
Okay.
My wife used to be the director of in-flight training for Continental Airlines. And what she did was she brought business first class into our dental practice. She's been the visionary for this. She helped me design this building. The interiors are all her. She's the one that does the training for the patient care. She has this phrase called, we're either green and growing or we're ripe and rotten. And
Oh,
so she is the person that is
I like that.
behind all of this. And she's just fabulous. I've got to give her credit for that because she truly deserves it. But probably the most important thing is that there's people that have made dentistry a commodity. They think that you can get the same thing at this place, at this place, and this place, and this place. And it's simply not true. Maybe there's three of those places where you can get something that's similar, but what you get when you come to consultants in dental aesthetics is a totally different experience. It's not about what you do for people, it's about how you make people feel. What do they remember when they're gone? It's how you made them feel. And we're going to make you feel like you were the most important person there and that you were treated fairly, that you were treated well, and you were treated with the utmost respect.
And I can fully affirm all of those statements. Thank you. Is there a quote or a life lesson that you use that helps you to keep leading?
God gave me a gift. He gave me influence over so many people in this world. And my job for him is to use that influence to help every person that I encounter each and every day to help them be the very best version of themselves.
Excellent. Thank you, Dr. Landry. And I want to tell people again how to reach you at
So, no, it's
HoustonSleepSpa.com.
Houston
Oh,
Smile
I'm sorry.
Spa.
Yes, thank you for correcting me.
Houston Smile Spa.
HoustonSmilespa.com.
And then we have another website that's called hsapnea.com. That's the sleep side of the office.
And hsapnea.com.
That's right. Mhm.
Thank you. And we'll be sure to put that in the show notes so that if people
Okay,
can click on that from wherever they are accessing the
great.
show.
Thank you.
Thank you again, Dr. Landry, and to your team here, consultants in dental aesthetics in Houston, Texas. And thank you for listening. That concludes this episode of the Keep Leading podcast. I'm Eddie Turner, reminding you that leadership is not about our title or our position. Leadership is an activity. Leadership is action. It's not the case of once a leader, always a leader. It's not a garment that we put on and take off. We must be a leader at our core and allow it to emanate in all we do. So, whatever you're doing, always keep leading.